Welcome to the ACS Bulletin Brief from the Front Lines, Surgeons' Voices. With these interviews, we may change it to Surgeons and soon-to-be Surgeons' Voices. With me today is Matthew Hay. Matthew is at Florida International University. And congratulations, Matthew, on the acceptance of your research as a presentation at our upcoming virtual annual clinical congress.
Yeah, thank you so much, Dr. Wexner. I'm really excited to be here.
Well, thanks for taking the time to be with us for a short while today. Perhaps first you could just tell us what year you are in med school and at what point in med school you got involved in research.
Yeah, right. So right now I'm a third year medical student at the Florida National University Herbert Wertheim College of Medicine. And I actually got a little bit of my start in research actually before going to medical school at the University of Florida. Working in various labs on some different mice models, and then also exploring the effects of traumatic brain injury and being able to understand anatomical changes using high-resolution MRI. And that kind of just spurred interest really in the scientific method and exploring how we're able to use these questions as tools to develop further understanding and then further implications for how we can, further whatever we want to look at in the field that we're interested in. And one of the studies actually that, the study that I'm the presenting author on, I was fortunate enough to be a part of two thoracic studies that were accepted. And my particular study is looking at whether or not adjuvant chemotherapy would improve survival in healthy octogenarians who are undergoing lobectomy for non-small cell lung cancer with unsuspected nodal disease, but who later had nodal disease after final resection. And so we were actually able to determine that a 5-year survival rate was significantly better in octogenarians, so those who are older than 80 years old, in both the in one group and in two group for lymph node metastasis. And the N1, there was a 14-month benefit, and in the N2 group, there was an 11-month benefit. And was really interested in looking at this because there's a lot of data outlining clinical trials looking at the efficacy of adjuvant chemotherapy in non-small cell lung cancer, specifically like stage 1 and stage 2 when they're small, like we looked at in this study. But those clinical trials are really looking at a much younger demographic, right? People in their 40s and their 50s. But the epidemiology is showing us, right, that this pathology is much, much more common in older demographics, those in their 60s and their 70s and their 80s. And so it was important for us to try to establish this relationship of a benefit of adjuvant chemotherapy in an older population that hasn't necessarily been studied as much.
Thank you. Certainly know your material quite well. I can see why you had it accepted for presentation at the college. Are you planning to continue this line of research? You've got some more time left in med school. What's the next phase? What question are you going to try to solve?
Yeah, I'm actually involved in many projects, and I think I have a growing interest in trying to integrate concepts in surgical care and then concepts of public health and the social determinants of health. And a large interest of mine is using geographic information systems, or GIS, and large data sets like the US Census data to then track disparity in patients that we're seeing who are coming to the hospital for surgical care, and seeing if we can link outcomes to different social determinants of health, whether it's race or income, or things as extraneous as if they have a car or not. And it was really exciting to see that this idea is starting to take hold. There have been 2 papers that characterized the social vulnerability index in cabbages that came out of the University of Pennsylvania. And then the Ohio State University published a paper using the social vulnerability index in hepatopancreatic surgery, measuring outcomes and looking at the differences really just based off of a patient's geographic location.
To stray from your research a little bit, which is certainly impressive, what do you tell your colleagues about why they should attend the ACS Virtual Annual Clinical Congress?
It's actually a great question. And at FIU, we sponsor an event called Conference Jam, where students who are going to conferences can come back and talk about their experience at the conferences and why they should go. And I actually did that last year for when I attended the ACS Clinical Congress in San Francisco, which was my first time ever, and I really enjoyed it. And my approach then was I had some people that I knew that I really, really wanted to meet and to network with, and I was very fortunate enough to have that opportunity to have that facilitated by ACS, bringing together surgeons from all across America and the world for me to be able to meet them. And then also, it's really incredible to see ACS take out so much time and dedication for the medical student session, the medical student portion, and really feeling and understanding how much that prepares us for our time in medical school, but then also preparing to go on to residency and further our careers.
Speaking of residency, what branch of surgery might you consider? And this was not a binding question, nor is it prejudicial. You can say anything from I don't know, whatever type of surgery you like, and you can change your mind later, but at least at present.
Yeah, I am planning and hoping to match into general surgery. I'm definitely leaning towards a 7-year program that it has dedicated research time. And I've always been really interested in serving a pediatric population. So obviously that would lend towards something like pediatric surgery. Sometimes it's a little scary to say, but I am really interested in congenital heart surgery. I think the pathology that you're experiencing there is truly incredible in what those surgeons are able to do. So not fully set, but I think a pediatric population and surgical care is what I'm really interested in.
Given the thought that you've given to your upcoming career and the detail with which you know your research, I have no doubt that you will indeed achieve success. I look forward to seeing your presentation, hearing your presentation at our upcoming virtual clinical congress, seeing the subsequent manuscript in press, and I'm sure hearing more from you on the podium and in our peer-reviewed literature in the future.
Thank you so much, Dr. Wexner.